Zak Zinter of Michigan suffered a very gruesome looking leg injury yesterday versus Ohio State, and at the time this injury was severe enough where he actually needed to be carted off of the field. The replay was also not shown on television because of how bad the injury looked, and at the time of the injury it was speculated that he was dealing with some sort of major knee injury. However, yesterday his mother actually posted on social media that Zinter was dealing with a fractured tibia and fibula requiring surgery. With today's video, we're going to look at the injury video and talk about the specific mechanism of injury. We'll also go over the relevant anatomy of a tibia-fibula fracture, also known as a tib-fib fracture, and what Zinter should expect when he goes to rehab. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. With this channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we can see here on the injury video that as Zinter is blocking, one of his teammates is going to block a defender and that defender is going to fall into that left leg. The tibia and fibula bones are two long bones located in the lower leg, and they actually span from the bottom of the knee to the top of the ankle joint. We can see here on the model that this tibia, also known as the shin bone, is significantly thicker than the fibula bone, and this is because the tibia bone is actually going to bear a lot more weight than the fibula does. As those bones come down, they're going to form the medial and the lateral portion of the ankle, so this is that thick tibia bone that's going to come down and form that medial malleolus. If you feel along the inside portion of your ankle, that's that bony knob there. And then as we move towards the outside, there's this thin fibula bone again, and that's going to come down and actually form that lateral malleolus. So if you feel that lateral knob on your ankle, that's what the fibula is. Now let's talk about the mechanism of injury for a tibia-fibula fracture. A lot of times we see these in things such as falls, car accidents, and of course, sports-related injuries. Anytime a force is great enough to actually come in and disrupt those two bones, that's going to result in these fractures. There are a couple classifications depending on where the fracture is located, and they are proximal and distal. Anytime it's said that a person suffered a proximal tibia-fibula fracture, that means that it is closer to the point of attachment, so it would be closer to the knee joint. If it's called a distal tibia-fibula fracture, then that means it is farther away from connection, meaning that it would be closer to the ankle joint. A common way to diagnose these fractures, of course, is the X-ray, and this is where we get into another classification called displaced or non-displaced. When we consider somebody to have a non-displaced tib-fib fracture, this means that there is a fracture in the bones, however, it's not to the point where the bones are out of alignment. And the opposite of that, displaced, is when there is a significant gap between the two bones because of the fracture. Displaced fractures are much more likely to require surgery for repair because we want to make sure that those bones heal in the proper alignment. These surgical interventions often require that hardware be secured in there with screws and rods to essentially make sure that everything stays in alignment to allow the bones to heal properly. When we get somebody in physical therapy after this type of surgery, it's important to say that there are weight-bearing precautions usually. So that means that the person is either going to be non-weight-bearing or partial weight-bearing, but this is dependent based on the surgeon. We follow this for about 6 weeks, and during this entire time, we are slowly working on ankle range of motion because we want to get that motion back to as normal as possible. At about the 7-week mark, this is when we can slowly start to progress towards full weight bearing, and this is once again dependent on the surgeon, and then we can slowly start to work in strengthening based on how the person is presenting. Usually at about the 5+ month mark, this is when the person can start to return to sports unrestricted. So unfortunately at this time, it looks like Zak Zinter is going to be in an extensive rehab recovery process. However, it looks like he's going to have the best care possible. And if I happen to hear any updates regarding on how he's doing in rehab, I'll be sure to update everybody in the comment section. So we wish Zinter the best of luck moving forward. He did have a significant injury, however, it could have been way worse. And it seems that as of right now, he's due to make a full recovery. Thank you so much for tuning into my channel today. If you enjoyed the way that I explained this injury, I'm going to go ahead and link another one of my playlists so that you can watch some of the other injuries that I've talked about in the past. Thank you once again for tuning in, and I'll see you next time.